Well, cortisone injections have a really, really, and don't say this to your client, but they have a pretty negligible effect. They have a small, transient, short-term benefit for most people. So they give you a slight improvement in over 2 to 4 weeks. Okay, and then after 4 to 6 weeks, it's back to baseline again for most people with cortisone injections. But the reason I say don't say anything to him is because there's a placebo component, right? If he thinks they did some kind of magic, medicine to his shoulder, that's going to cause some kind of benefit. So don't go and bursting his bubble and saying, "Oh, that was a bunch of crap and won't help you," because you might make his shoulder pain worse. So all those cortisone injections, they're magic. That's awesome. I expect you're feeling a lot better now. So shoulder pain can be caused by a complex, range of things, and we don't really know. The short answer is we don't really know what causes shoulder pain. I mean, there are obvious cases where someone dislocates their shoulder or something, and that, those aside, the garden variety shoulder pain where someone goes, "Ouch, my shoulder hurts," and you're like, "Did you fall and land on your shoulder or something?" They're like, "No, I just woke up one day and it was sore," Like that's most people with their shoulder pain. Or just gradually, as I was doing a particular activity over weeks and months, every time I did that activity, it hurt a bit more or whatever. And you're like, "Are you doing a lot more than you normally do?" "No, just doing the same thing I've been doing for decades. Now it's just started hurting for no apparent reason." So that's kind of the normal run of how shoulder pain presents. Despite decades of research and hundreds of research papers, we're really not much the wiser on what causes it, although we have crossed off shoulder impingement off the list. Yeah. We do know a few things about shoulder pain that, what helps it is psychological factors predict outcome more than clinical factors. So the biggest predictor of successful outcome in shoulder pain is a belief that they'll have a successful outcome, right? So, and there's a couple of large, like 1,000-person trials that have found this. Like basically they get all the people in with shoulder pain, they test their strength, range of motion, pain, MRI, all of that stuff, and they find that all of those things have pretty minimal relationship to the outcome 12 months later, although highly disabling pain or more intense or severe pain at baseline predicts a worse outcome. But actually, even more than that, the biggest thing that predicts outcome is their expectation of outcome. So if they think they're going to get better or worse, they probably are. Yeah. So, and that doesn't necessarily say that we can influence their outcome by changing their belief, because it might be that they're just accurately sensing whether they're going to get better or not, right? So it might not be that their belief causes the outcome. It might just be that like, "Oh no, that something feels really wrong in there and I don't think I'm going to get better," and maybe they happen to be correct about that. But it doesn't say that that's not the case. So it might be the case that when you expect to get better, right, or if you expect that going to physio and getting your cortisone injections and doing your home exercises is going to help, well, you're much more likely to do those things. Whereas if you think, "Well, I'm not going to get better, what's the point?" you're much less likely to do those things that are going to help, and so therefore possibly much less likely to get better, right? So who knows what's the chicken and what's the egg, but we do. I can say with a high degree of confidence that doing shoulder exercises is not going to make his outcomes any worse, and even if his pain doesn't get better, he'll still have pain, but he'll be stronger. So it's like, oh well, that's better than still having pain and not being stronger, and it may well help his pain. He may well, get back to full function. And at the very least, like when he comes in to see you, he gets a social interaction, maybe have a cup of tea and a biscuit afterwards. Maybe he hangs around with other clients and gets to chat with them in the waiting room, or, like for a lot of people, and I don't know about this person in particular, obviously, but for a lot of people, like especially in COVID, like that might be his only social engagement for the week, right? It might be the only time he gets out of his own head. So I think there are a huge number of benefits to exercise, even if it doesn't fix his shoulder, which it might. Yeah, but you're doing the right thing. It's like load it up as much as you can tolerate, And if it's still sore 2 days later, you've loaded it too much.